Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat, the UK's leading veterinary podcast. I'm really excited today to have Ian Battersby and Fergus Allerton on with me. We're going to be talking about all things antibiotic stewardship. And of course, we're going to also be talking about the amnesty that's coming up in November. We'll share a bit more of the details of that later. But perhaps first, just to start, Ian and Fergus, do you want to introduce yourselves to the audience, please? Ian first.
Oh, Ian first. So, my name's Ian Battersby. I'm a double-boarded internal medicine specialist, and I used to run the medicine department at Davies Veterinary Specialist, but my current role is now responsible pharmaceutical stewardship lead for Mars Veterinary Health. And my interest in this area started about 10 years ago, and I created the PSAVA Protect scheme, and that's a nice seamless link because Fergus took over that mantle in about 2016, I think it was it Fergus? So over to you.
Yep, so my name's Fergus. I'm an internal medicine clinician working at Willows in the West Midlands, and after becoming the chairman of SAMSOC, I did launch the second iteration of Protect, which was Protect Me, and I have been really interested in the area of antimicrobial stewardship since then. And we're now looking at more and more ways that we can improve the way we're using antibiotics in the veterinary profession. How can we engage with our stakeholders, our clients, our owners? How can we make sure that vets can optimize their antibiotic use? And I think that's something that Ian set the ball rolling some time ago. We've still got a way to go, and we've really got to keep working hard to optimize that.
It's definitely an area that we've been interested in Webinar Vet for a long time. And I remember also going to Vergava in Dublin, and we were talking about antibiotic stewardship with David Lloyd, obviously professor at RVC at the time. And it was in a very small room, and the room wasn't full. So it's been a topic that perhaps hasn't been as exciting as it maybe should be, or as worrying as it should be, because obviously we have these antibiotics. And I know I see some scary figures, in the human world of deaths that are now due to antimicrobial resistance. And we obviously, that part of our responsibility as vets in a One Health situation is that we use antibiotics responsibly, as well as obviously the doctors and so on. So perhaps tell us a little bit about Protect first, how that has first of all started, Ian, and then how it's iterated with you, Fergus.
So how it started, it was it was a personal experience really that started it for me. I had a really bad wound on my hand that hadn't responded very well to the empirical course of antibiotics prescribed by my GP, and I ended up in A&E. And I will admit that I was asking for some potent antibiotics because my hand was very, very swollen, and I was very worried about it. And the doctor was amazing, really. He was very patient, and he explained some of the stewardship measures that were in place at the hospital. He said for the drugs I was asking for, he'd need a positive culture, and he'd need the microbiologist for the hospital to sign that off. And that was just like mind blowing, considering that some of those drugs we could just prescribe as vets, without on our own. So posted on the SAMSOC forum, has anybody got any stewardship protocols in place? And I think there was only Cambridge who had some protocols in place. So then it just evolved, really. It was like, well, we need to do something about this. We need to start talking about it. We need to start creating some guidelines that people can use, because one of the challenges is you talk about the principles, but we're all busy people, and making those decisions on what you need to use at the right time, and things like that, and which in for certain conditions, it takes time to formulate that. So we created the Protect poster. We wanted it to be positive. It's a bit of a doom and gloom situation when you talk about antibiotic resistance long term, but we do have an opportunity to protect these drugs from not working anymore, and protect our prescribing rights as well. So I have to admit, it went. I look back now about 10 years ago, and I guess it was there wasn't quite the engagement on it, so it was a bit of a poison chalice, I think, to some respect. And
Yeah.
and the guys who helped me produce it, they were amazing. We had members of primary care, Ali Woodward and Mark Maltman, and we had a couple of referral clinicians. Ian Ramsey helped as well, and we created this thing that actually did a lot
Yeah.
better than what we realised, really. So, and then Fergus took over the mantle. He took over chair of SAMSOC and took over the mantle and evolved it beautifully in the way it needed to go. So
Ian,
that
I
was
suppose I have
that
to
was me
ask,
linking
it's
to you.
always nice to hear the end. Yeah, but I was going to say just very quickly, it's always nice to know the end of the story. So I need to know, wound on the hand, was that a dog bite or a cat bite, or
It was a
where did
cat
the
bite.
wound come from, or would you rather not say?
Yeah, it was
Cat
it was
bite.
a it was a cat bite, a really nasty one. And I'm embarrassed to say I can't even remember the name of the cat, but obviously that cat started a cascade that massively influenced my career. Really, not only the doctor who chatted to me, but
Yeah.
if that cat hadn't bitten me, I wouldn't have ended up where I am today.
And how did the treatment go? What happened after that? Was it just a case of more localized lavage, or how did he treat it to get you hopefully back with your hand working again?
Yeah, well, um, ironically, he just used a higher dose of amoxiclav and lavage as well, and it did resolve.
Yeah, good
He
sorted.
he didn't
Yeah,
take a culture at the time, but yeah, it took about a month in total to get better. He just had a bad week where it really swelled up, and yeah, I did a lot of important things with my left hand. I'm right-handed, but left hand's quite
yes,
important.
yeah. Well, it's still nice to have both of them, isn't it? And maybe Ian, you just look lither and slimmer than you actually are. Maybe they just didn't weigh you properly to do the dose. As I always say with dogs, with
Yeah.
dermatology problems, the number of times I would have cases referred where it was the dog's 25 kilograms, but they're only giving it a 250 milligram amoxicillin clavulonate acid, and of course you're trying to keep it cheap, but actually you're not serving anybody by giving a bit less of a dose than you should do for a bit shorter time than you should do, isn't it? At least at that time, that was sort of the rationale, that treat long and properly rather than half-heartedly.
Well, I mean,
I'm going
you
to
make
butt in there because
Go
I
well,
on,
think
Fergus, go in and tell us Protect 2 and the end
you
of
can
that
see him
story.
chomping at the bit.
well, I think we have to be careful with the recommendations and what you say, long and high dose and proper. It has been a mantra for a long time, but I think
Is
that is
moving on.
shifting, and shorter is better.
Yes.
And it is important that you give the right dose so that you can achieve effective concentrations that
Yeah.
will treat the bugs in the site where they're at. Must remember that not
Hmm.
all antibiotics penetrate equally in certain
Yes.
sites. But I'm really interested in antibiotic duration, and course length has historically been an arbitrary number
Yeah.
based on how many fingers we've got on our remaining hands. So
Yes.
it might be shorter for Ian. It has been sort of multiples of 7 as well.
Yes.
I think that we lack the evidence to offer sensible recommendations for antibiotic duration. And
Yeah.
that's something that we need to work on together and to try and change, because it may be that we can achieve an effective clinical outcome with shorter courses. And if we can bring
Yeah.
the typical course length down, it will reduce our overall consumption. There is no point using antibiotics when the condition has been resolved. So I think that there are some really interesting things, and that's one of the limitations, I think, of all the guidelines we have. They are historical timepieces,
And
and
not
they reflect
evidence-based.
and they lack the evidence that we require. And
Mm.
hopefully, they highlight some of the gaps in that evidence so that people can go and ask those questions and provide us with the evidence moving forward. We would love to be able to tell people how long a course of antibiotics to use, what's the ideal antibiotic, what's the ideal dose, and definitively, what's the difference between using antibiotics and not using antibiotics. Because
Yeah.
it may be that antibiotics do confer a small benefit, but is it a benefit that justifies their use? And there was a paper recently that showed that metronidazole could very marginally reduce the duration of acute diarrhea. But is that a justification to give all
Mm.
acute diarrheas metronidazole? I certainly don't think so. And I think that we should try and do these studies and see what actually where we can avoid using antibiotics,
Yeah.
and be able to hang our hat on that work.
Did you know the Webinar Vet has a public community Facebook group? We want to ensure veterinary professionals have a place to stay in the loop with everything that's happening here at the Webinar Vets. In this public group, you can chat and network with other veterinary professionals from across the globe, get exclusive updates, content recommendations, and so much more. Pop and say hello to a community of over 2,000 veterinary professionals by searching the Webinar Vet Community on Facebook.
Fergus is right. I mean, certainly, the ethos now is treat well, treat optimally, and for as short as possible. And it's a real area of interest in human field now. They're doing studies looking at, I remember reading one, comparing, 10 days of antibiotics for 1 day of antibiotics for otitis media in children, and there was no difference. Like Fergus was saying, traditionally it was multiples of 5 or multiples of 7, which are convenient numbers.
Yeah.
Why would a bacteria know 5 days as a time concept that it's going to respond to? It's just, we use these measures, and it's really important that, particularly in companion animal, because we haven't got that evidence, that we get involved in studies to try and shorten these lengths of courses that we're using.
I was about to say, one of our lecturers on Webinar Vet is a guy called Mike Willard, professor over at Texas A&M. He's just retired, and he's a very humble guy, and he says, what I taught you 10 years ago was a lie I just didn't realize. And it's really true, isn't it? Some of the stuff I did on dermatology 10 years ago, it's obviously adapted, using shampoos, trying to use adjunctive therapies so that you don't need to use as much antibiotics. And of course, we've seen some success with those measures. I think I saw some results recently about the amount of antibiotics used in farm animal medicine now has really reduced because of that stewardship and because of that care of, right, you really need to think about this before you can use an antibiotic drug on a cattle or a sheep or whatever, a cow or a sheep.
And Rumour, who've led the way in many respects, they have achieved a lot. But one of the ways that they've done that is through engagement of all the important stakeholders.
Yeah.
So they've talked to the farmers, they've talked to farm vets, they've talked to the buyers of some of these products. So if you want to sell your milk to Tesco's, they will set a certain antibiotic threshold. So that does put a pressure on the farmer not to use them unless they absolutely have to, because there is economic advantage in it. So I think we need to do something in our own way in the companion animal, small animal field, and make sure that we do engage all the important players, from vets to owners, wherever possible, to make sure that everyone's on the same page.
Rumour have done fantastic, and from a farm animal point of view, I guess we've just got a different dynamic to manage, because Fergus highlights some of the different areas where they're able to target. Because if you've got a purchaser of your product saying, I want you to reduce how much antibiotic you're using, that's a driver. Whereas we've got to consider the pressure of the consult room, and we want to support vets in that difficult situation where you've got an owner who's very worried about their animal, and we don't want people to use antibiotics just in case. We want them to feel confident that they use it when it's indicated. And it's what, when you've got that emotional situation, it's a harder thing to step away, to use that barrier. So that's what we've got to work on, supporting, getting culture in a practice to support all the vets in the practice to make those I'm not going to do this just in case decisions.
Obviously, one of the problems, though, is also around compliance. And sometimes we will give a course of antibiotics, and perhaps rightly, perhaps the clients know more about this than we do. And after 2 days, 3 days, they do stop. But they're left with 3 or 4 days of antibiotics at home. And I suppose, with a sort of careless hat on, you could say, well, we can throw that in the bin, which will go to landfill, or we can flush it down the toilet, which will get rid of it. But of course, a much safer way of doing this is that we actually get those medicines back into the practice, isn't it?
Absolutely. You raise a very important point there, and we do know from human studies that about 1/3 of people keep hold of their antibiotics, and then they'll use them either for themselves for something else. They've got a cold and they'll think, well, I'll go and check the kitchen cupboard or the bathroom cabinet for some antibiotics. Maybe they'll help, so they're using them inappropriately, or they'll give them to their friends or children or things like that. So they will become the prescriber, and this risks significant adverse effects associated with those antibiotics because they may not be used in an appropriate way, and it also risks the antibiotics are not going to where we want them to go. I think that we are really keen to offer safe disposal to all antibiotics that have been left over, all unused antibiotics. And at the moment, roughly 8% of antibiotics are returned to the pharmacy. And we want that to be far greater where they are left behind. Veterinary antibiotics count for this because, as you say, if they go down the toilet, if they go into landfill, they will potentiate the problem of antimicrobial resistance, and they will act as a pollutant of the environment. So we want to avoid those routes and get these antibiotics back so that they can be appropriately disposed of. And over the course of November, that's what we're asking owners to do, to return their unused leftover antibiotics back to their vet practices so that they can be safely disposed of. And I think that if we can encourage that, we will bring some antibiotics safely out of the environment, and that will be a massive gain. But the other gain will be get more people thinking about this important topic of antimicrobial resistance, getting those conversations going, and people will suddenly realize, actually, these are things that we need to treat respectfully so that they can be useful in the future. Let's keep antibiotics working for when we really need them.
Any thoughts, Ian?
No, I mean, absolutely. I mean, I think this is such an important initiative, really. These are biologically active agents. So naturally, if they go into the environment, they will have an effect. And if you talk to people who research antimicrobial resistance, one of the places where they'll go and sample is sewers, because that's where a lot of these products end up. And obviously, then you've got a cocktail of optimal conditions for bacteria to select for resistance. People, if you flush them down the toilet, that's where they're going to end up. So, antibiotic, I mean, the principle's the same for all drugs, really. We want to dispose them appropriately, but obviously with the AMR issue, this is a fantastic initiative to combine both those topics, really.
The amnesty is set to go for November, isn't it, Fergus?
It is. It will run for the whole of November, and this is a One Health initiative. This is something that the veterinary profession, I'm proud to say, have really bought into across the board. So we've got support from the Veterinary Medicines Directorate, from BVA, BSAVA, NOAA. All the big corporates are behind this idea. They really want to encourage vets to get involved. But we also know that NHS Midlands are doing it. They're trying to get human antibiotics back to their pharmacies. Local dentists are trying to do it as well. We're all in this together. And as Ian said, we're looking at rivers in 6 out of 7 continents are showing signs of antibiotic residue. Now, it's not all from throwing them in the bin. They go through us and end up there as well. But it is a significant route that they could end up in our environment. So let's stop that at source by not disposing of them into those environments.
So I think the idea, Ian or Fergus, is that if people, the veterinary practice, is there a way that they can advertise this to their clients? Are there some resources on the internet? Are there posters that practices can perhaps get hold of? How will that work?
We've created quite a lot of resources already, and these are will be hosted on the Rumour Companion Animal and Equine website and the RCVS AMR Knowledge Hub. So you can access those, and we are encouraging vet practices to download posters that they can put up in the waiting rooms to make owners aware. They can mention it in consultations. They could put it in any newsletters that they're running. On social media, we've created a little animation that we hope that practices can share with their clients base, and anything that increases awareness. We would like to learn from this experience. This is the first time an amnesty has been run in this format, in the UK certainly, and we want to try and learn from the process. We have set up a little research study to run alongside it. This will be QR code linked, so if you see the posters in your vet practice, you'd be able to scan that and access a short survey that tries to assess owner awareness of the importance of antibiotic disposal, and also asks them the question, why have you ended up with a ton of enrofloxacin in your bathroom cabinet?
Yeah.
And we can hopefully establish, well, what are the driving forces for that? Is it that we are giving too long courses? Is it that some cats or some dogs are impossible to tablet? Do they have adverse effects that we're blindly unaware of? Because we probably underreport these things in veterinary medicine. So we hope that we can get more information that will inform our recommendations in the next iteration of Protect Me as to how we should be prescribing in the first place. Because there's no point in giving unnecessary medication. We don't want people's to end up with this product in the first place.
So as you say, some of this will be about the amount of antibiotics we give in the first place, and maybe we have been too generous with that in past history.
Absolutely. And I think that we don't always know, and we would rather sort this problem definitively in one go. But owners, like all of us, will use antibiotics for as long as they feel they can manage to do it, and that it is achieving what they want to achieve. So there will be situations where they end up with leftover medication. If we can work out what they are, we could guide future prescribing habits.
Fantastic, Fergus. Any last thoughts, Ian, on this? I know this is an area that obviously you're very passionate about, and it's great to see one of the corporates actually having, somebody who's just responsible for this area as well.
Yeah, no. No, I mean, I guess if we take it a few steps farther back, if you think about the principles of sustainability and better for the environment, by identifying areas where we're using medications unnecessarily, prescribing too long a medication, there's less medications need to be produced. So you've got all that manufacturing and transport and stuff. So there's that aspect right at the top of the tree. Then you've got the patient. We want to make sure it's optimal treatment, and we kind of have when I was at vet school, it used to be the more antibiotics to cover you cover all quadrants. That was the ethos.
Yes.
And there wasn't a
Yes.
perception that there was any harm really from doing that. But we're now starting to understand how important the microbiome is, for health. And so, by minimizing these courses, we may be we're still learning about the microbiome, but we may improve patient outcome by shortening the courses. So there's lots of benefits in this area. When you start, it's like a spider's web when you start thinking about all the different impacts it can have. So, I'm just really excited. This is a fantastic initiative, and the first time it's happening in the UK for the veterinary profession. It's brilliant, absolutely outstanding.
And I think, as Fergus said, it's very much a One Health thing, because it's obviously beneficial to us as humans, but also to animals. But as you said, even with the just less production of antibiotics, it's great from a sustainability and a regenerative perspective from the environment as well. So I think it's a fabulous initiative, fabulous thing that Rumour, and I know, Fergus, you've been very involved in setting up, and I just hope it's a rip-roaring success, and maybe we can do another podcast to see how it's actually gone, after it's finished and everything.
That would be brilliant, but I really hope that we can all get behind this. And we are conscious that vets are very busy at the moment, so we've tried to keep this something that people can get engaged with at whatever level they want to. If you can, and it is going to be across the vet practice, so the staff at the front of house will be able to mention it to owners as they're in the waiting room and encourage them. Nurses who are helping discharge patients can hopefully bring it up with owners, and obviously vets during consultations as well. I think that raising awareness is going to be a real benefit from this study, and any antibiotics we can reclaim will be an added bonus. So I really encourage all practices to reach out, get involved, have a look on the RCVS Knowledge and the Rumour Companion Animal Equine websites, and let us know how you get on. Let us know your feedback, what was good about this process and what was difficult, and how much antibiotic did you get back. And in doing so, you get access to a free draw that will, well, it's one of those lotteries. So you can hopefully win either a free Congress ticket. There are some RCVS Knowledge library accesses, NOAA companions, BSAVA manuals, and I think, Anthony, you were going to offer
webinar vet
a prize
membership
as well.
Yeah, so it sounds like it could be fun.
I hope so. And that's the carrot to try and get people involved. We want to say this is so valuable for everyone. Please look into it, consider getting involved as a practice, and let's see what we can achieve together. We're all going to be much, much stronger together.
There's a massive cumulative effect as well, with this kind of situation. As Fergus highlighted, people are incredibly busy on clinics, but for practice, if somebody in a practice just has 1 or 2 conversations throughout the entire month, altogether, if everybody does that, that makes a massive difference. It really does. So and it's a win-win as well. There's a draw, prizes. What's not to get involved?
And it just makes great sense as well, doesn't it?
Yeah.
Ian, Fergus, thanks so much for giving your time. Really appreciate it. I know how busy both of you are. So thanks for coming on the episode of VETchat. And hopefully we'll find out results very soon and we can feed that back as well. Thanks both of you.
Thanks for having us.